probably anywhere between 50 to 70% of us have some form of oral disease.
What's happening in your mouth is linked to Alzheimer's and heart disease, and it starts with your toothpaste.
Dr. Mark Burhenne is a leading functional dentist on a mission to fix your mouth.
If you want to lose blood pressure, drop the mouthwash, start tongue scraping. I know a lot of cardiologists that have taken their patients off of high blood pressure medication. It's the bug getting into the brain and how the brain reacts to that bug that causes Alzheimer's. There are other things you can do. It's not just diet. Mouth breathing, dryness of the mouth, dehydration. Most dental products are causing a dysbiosis of the oral microbiome.
And talking about fluoride, so a very controversial topic as we were talking. What are the effects of fluoride itself on our health? Not just oral health, but overall.
It's complicated, and it's because this has become a political issue. And for a long time, my stance on fluoride really was I was ridiculed for it in Sunnyvale, in the Silicon Valley. I went to a town meeting once. There were 300-400 people there. Most dentists that were there were speaking for fluoride. We were voting on whether fluoridation would be required because in the Silicon Valley, the water supply is so fragmented that there was no one place where you could add the fluoride and then, so it was mandated. I think it was the year 2000. So I spoke against it. Nobody was listening. I had my moment on the stand. I literally was followed out by two guys, very, very pleasant. They were both attorneys or lobbyists, and they really wanted to know more about why I felt this way. And there was a lot of resistance to it. But now, I mean, we've got a lot of data that supports thyroid dysfunction, density of our long bones, hip fractures. The big one that has made the news, and we have the most data on, is brain health. To a developing brain, whether it's an infant, a teenager, a young child, or even a fetus, the fluoride in the water at certain levels, which we've been able to measure, and these are studies from all over the world. They're all at least 15 years old, most of them accepted by the NTB, and discussed in detail in a 6 or 7 year lawsuit on the federal level against the EPA, which was won by the plaintiff, the defendant being the FDA, sorry, the EPA. They lost, although they're appealing the case. The discussion was scientific and it was very balanced, and the side favoring fluoride could not defend their case that ingesting fluoride was not unsafe and did not affect the IQ, for example, of a developing brain. And so that was very gratifying for me. Stance on fluoride goes way back, but now finally, I never thought I would see that day. I think it was last August 24th, 2024. Yeah. And so we've got the data. We need more data, obviously, but there's enough data, overwhelming data, that supports the notion that there are toxic levels easily attained in current lifestyle by drinking water, by taking in, toothpaste, swallowing toothpaste. We're not dosing the fluoride correctly to our patient pool and to our citizens, and we are causing a lot of damage. And again, the U.S. we have more fluoridated communities here, or per capita users or end users of fluoride, than we do in the rest of the world. And everyone else has the same decay rate. Europe doesn't fluoridate. Most of the countries there don't fluoridate, and they have the same decay rate. I don't know about Brazil, but
very fluoridated. Everything in the US, just think Brazil updates it in 1-2 years. It's literally the same thing.
That's too bad. Sorry, Ben.
Yeah, unfortunately.
Anyway, so fluoride has many mechanisms. In dental school, I was taught that fluoride is bactericidal. This is in 83, 84, maybe 85, somewhere in there, those 3 years, that it was bactericidal, that one of its mechanisms, not just combining with calcium to create a fluorapatite crystal, which would be more acid resistant to low pH levels in the mouth and would help the teeth be stronger and more resistant to acid, which is true. Topical fluoride does do that. and that's not the ingestion of fluoride. Those are two different
Mm-hmm.
modalities or
Yeah.
methods of bringing fluoride for preventative purposes to a human. Um, uh, and and I thought, okay, well, that's interesting. I always thought that was great. You know, like, okay, brush with a little fluoridated toothpaste and you're going to knock down some bacteria. Well, now with the knowledge of the oral microbiome, this is not a good thing. We don't want
Mm-hmm.
bactericidal products in our toothpaste. Essential oils, surfactants, emulsifiers, botanicals. I mean, excuse me, all of those things
Mm-hmm.
are bactericidal to some degree, including fluoride.
Why was it included anyways? Like no signs, no nothing. Why was it included on the on our water, for example?
Yeah, in the US, I don't know about the rest of the world, but I think it started in the US. There was a dentist that noticed in Colorado, in a small town in the hills, it was all the water was coming from a well water. It was high in fluoride. And what he did notice is that there was less decay than his counterparts, maybe, outside of that area. He also noticed that there was a lot of fluorosis, a lot of decalcifications, white and brown spots on the teeth. Um, it was all correlation, kind of a clinical observation on a very small scale. Then it was it ramped up a little bit within dental organizations. Then Alcoa, the aluminum company, I think they were down in the deep south somewhere. They looked at
Mm-hmm.
the data and they thought it was fascinating. Unfortunately, that company was looking for a way to get rid of fluoride because it was a
Mm-hmm.
byproduct of some of their manufacturing practices. Also, with the phosphate fertilizer industry, the same. And it kind of just got picked up, and it was, I think, not a fluke because there was intent behind it, but the intent was not scientific and it was not based on solid data. And as it turns out, it was a mistake.
And what would be a better option then for fluoride, I would say, in our toothpaste and our day-to-day
Right.
basis?
Well, in the water, there really isn't a good. I mean, fluoride dissolves well in water and is
Mm-hmm.
stable, and it's very reactive. So when it comes into contact with a demineralized surface, it will, or with another ion like calcium, it will react with it and combine with it. All the other ingredients in the mouth, like calcium, phosphate, that doesn't work in water. But in toothpaste, there are ingredients, nanohydroxyapatite being the
Mm-hmm.
next big thing in making teeth better and stronger and more resistant to decay. And that happens to be the same ingredient that our teeth are made up of. So it's kind of like a no-brainer. And it's been in use in Japan for over 50 years.
Mm-hmm.
There are now nano versions. Some people get a little triggered by the word nano, and certainly nano
Mm-hmm.
inert metals and products that don't
Nanoplastics.
dissolve and plastics are not a good thing. But this is
Mm-hmm.
nano calcium phosphate and water, essentially. It dissolves, it breaks down,
Mm-hmm.
and we have the EU has determined that there is a safe, very safe version of it that can be used in cosmetics and can be used in toothpaste, and it works very well. We have a lot of data that it's safe and it's effective, and in many cases, in toothpaste at least, and in topical forms and in varnishes, even in mouthwashes, we're seeing it now that it is as effective, if not more effective, than fluoride. And that's all we need to know. And when it, let's say you put nanohydroxyapatite
Mm-hmm.
into toothpaste, that's a great place to put it. Um, it dissolves in your mouth into the saliva. It's the exact same form that we see when a food comes through, like a leafy green vegetable, or if it
Mm-hmm.
gets digested and comes back through the saliva gland via the bloodstream and gets excreted out in saliva. It's a 20 to 40 nanometer particle of calcium, phosphate, and two hydroxyl groups. So,
Mm-hmm.
if you want to add it to your toothpaste, great. Hopefully, you've got a good diet and your body is producing or absorbing that calcium. Vitamin K2 is important as well, and vitamin A to produce that effect. Then this is what we need in our saliva. We know it. We see it. We take healthy saliva and we see nanoparticles of hydroxyapatite in there, and we know the shape and the size and the ratio of length to width and everything. It's really a no-brainer. But fluoride's kind of re, kind of been sitting in that spot. It's like a peg in that hole,
Mm-hmm.
and now that the fluoride peg has been removed, now we can look at other options that are way safer, and there's no damage to the brain and all of that. So.